Stroke is a focal neurological deficit, which is of no other origin but cardiovascular in origin.
Depression is the leading cause of disability. Depression on its own is a persistent feeling of sadness, persistent feeling of hopelessness.
Chronic kidney disease has become a public health problem. The global prevalence is on the increase and it is associated with high morbidity and mortality. According to the 2010 Global Burden of Disease Study, it was ranked 27th in the list of causes of the total number of global deaths in 1990. However, by 2010, it had dropped to 18th on the list of causes of global death. More than 80% of patients worldwide who receive treatment for kidney failure are in affluent countries with universal access to healthcare. But in developing countries, it is a great burden considering the poor state of its medical facilities. The great news about chronic kidney disease is that it can be avoided or prevented if proper care and consideration is given to the kidney and if the infection is discovered early. On the program today, we shall learn about the kidney and how to care for it. My guest today is a popular face on this program. He is Dr. Chubike Chimdi, and is a specialist family physician at the Metama District Hospital here in Abuja. Dr. Chimdi, you're welcome back to the program.
Thank you so much.
It's good to see you.
Good to
I already know how to pull you out and get you on the program. Well, I remember the last few times you've been here, we talked on stroke management and we also talked on diabetes. And today we continue with care for the kidney, which I think in the past months, I've been hearing kidney failure, kidney issues, the person has problem with the kidney, or the kidney stopped working, different, stories about the kidney. And then I was thinking, okay, we should do a talk on what is this kidney problem? What's happening? Why is it on the increase? It was 27th before on the list of global disease burden, and now it's 18th, it's dropped down there. So, but the first thing I want to know before we start talking about the whole problems of kidney, what exactly is the function of the kidney in the body? That's where I'm going to start from.
Thank you so much.
Yep.
The kidneys are very vital organs in the body. In our bodies, we have very organs like the heart, the kidneys, and the brain that takes care of most activities in our
body.
Bodies.
Yeah.
And then the kidneys, they are located at the back. It's every person have two kidneys. And that's for the normal ones. There are people who congenitally or from birth, they could actually come with one kidney.
Just one?
Yes, they could have one.
Okay.
The two joined
together.
So,
all right.
But in a normal person, you have two kidneys, which is approximately the size of a fist.
Okay.
So we have that size in our bodies.
Okay.
The kidneys actually takes care of eliminating all the waste that we generate in our body.
Okay.
It helps in regulating water and electrolytes. Electrolytes are actually things that controls the activities of the body.
And the body is
the kidneys also is a place where a particular chemical which helps in production of red blood cells, which what we call erythropoietin, is actually produced in the kidneys. So you can see that for us to have the red blood cell, which is the cell that carry oxygen in our blood, we need the kidneys for those
to produce them
for that function to actually take place. We also have in the kidneys a place that helps us in producing vitamin D.
In the kidney?
Yes.
Vitamin D?
Vitamin D.
Okay. All right. Okay.
So you see that these are critical functions. I'm sure most of us recently during this COVID era, people have talked about supplementing vitamin D and vitamin C in our bodies. So we can also see that the kidneys are very important in producing this vital vitamin, which helps in building the immunity of a person and making sure that we stay in good health. the production of urine
Okay.
that we also make is actually done in the kidneys. The kidneys are made up of what we call unit cells, or
Okay.
what we call nephrons.
Okay.
There are more than 1 million of that, and because of the way they are structured, everything that we're taking, water, toxins, are taken away through the kidneys. And then it's also at this level that some elements, electrolytes that want to get out of the system,
Okay.
the kidneys also bring them back, so that there could be what we call maintaining balance,
Balance,
of our
okay.
electrolytes, maintaining balance of the water level in our system,
Oh, wow.
and having enough for us to take care of our body system.
Wow, that's for such a small or less known or little known about organ in the body. That's a lot of function for you to do. You know, no wonder, you know, I don't want to jump this, but I just wanted to say, you know, when I see the machine that does that you have to run your blood through when you have dialysis, you know, you just wonder, you need this big machine to replace what something that little, you know, it's doing in the body. Amazing what the body. So balance electrolytes, I like that fact. It helps you balance electrolytes. Then production of urine. So this urine will just go and pass out anytime. It's not just, it's the kidney that make them and, you know, release them. Then
Production of
erythropoietin, that is, yes, in the red blood cell, yes. Okay, quite a lot of function. So now what we're looking at today is kidney. It doesn't just start having issues, but kidney, when it has issues, it's like the whole system is in, I can understand with all these functions, you're saying the whole system is in trouble, but what could cause the kidney to start having issues? It obviously doesn't just start suddenly. Before we start talking about the care for the kidney, yes.
In the introduction, I try to say that the kidneys has over 1 million nephrons.
Okay, so these are little cells,
very little cells that
okay,
helps in the filtration process that goes on in the body.
And this 1 million nephron, they fit into that small organ.
In a small organ, and all that. So it means that there's a lot of options that these nephrons, as many as that 1 million, that are in the kidneys, that helps in carrying out these functions. But over time, when we start having things that affect these nephrons, we can actually start having problems that will start developing. Some of these problems will start from, one is the possibility of a congenital problem, as just like I said earlier on. If these kidneys were not properly formed ab initio, from the time before birth, it means that the function of the kidney will not be optimal. They will not function at its best.
So from birth,
there's a class of kidney problems that come from birth, because they are not well formed. Then all the other ones are also the ones that after birth we now have problems that could generate from it. This will now, we can classify into just from simple infection. Remember, urine is produced and is taken out through the bladder, and then we pass it out. The same way, from the way we pass urine, we can actually get an infection that will go back, because they are all connected through the urethra to the bladder and back to the kidneys. So if we have any form of infection in the whole gamut, we call it urinary tract infection, that can actually ascend and get to the kidney. It can cause a malformation or a malfunction of the kidneys.
So if that, I want to come back to that, the infection, when it goes, so, you know, because we are exposed, I think especially the women, I don't know how much it applies to the men, but you know, because the women especially are very well exposed.
Because they actually have a short urethra.
A short urethra, yes. So it's easy for infection to you know, to go from other, and I know even from the anus, I know there's I think it's urinary tract infection. You can take infection from the anus, and then it goes into and causes, and that alone can cause damage to the kidney.
Can just damage the kidneys. and all that. So
Oh my God.
there are
Okay.
multi-factor because
Okay.
of through the urinary tract infection, it's ascends up to
Okay.
the bladder, to the urethra,
Okay,
and then the ureters are connected to the kidneys. So with this ascending infection, it damages the kidney. That is one. We can also have toxins. Remember, we talked about the kidneys taking care of every product that we have in our system. When you take in chemicals, when I mean chemicals, including the regular drugs, overdosage of drugs, overdosage of some opioid substances that we abuse, cigarettes, alcohol, when we have a lot of all this, and the kidney is overwhelmed, that they can't take away these toxins, they can't take away this particular load that's been given to them. When they get overwhelmed, there's a problem in the kidney.
So everything
as
you
well.
eat, everything you drink,
Yes.
somehow
Yes.
passes through the
kidneys.
kidney. Oh,
And
right.
especially all the liquid components
yes.
of what we're taking will pass through the kidneys. And as I said, electrolytes is also handled in the kidneys.
Okay.
So every nutrient that we pick out from the food that we eat, sodium chloride, potassium,
yeah.
and
All the
urea,
ions
and the supplements, everything gets down to the kidney. So it's actually at the kidney that we have what we call reabsorption to
Okay,
preserve
okay,
them, so that's to maintain
Balance.
that balance that is
Okay.
expected. It's actually when the system cannot handle this
Okay.
and they get overwhelmed that the kidney issues that we'll have will come about, and then there will now be an affectation of these nephrons,
Okay.
just like some other causes I was about going to mention.
Okay.
Diabetes will
Okay, diabetes. Okay, the normal
diabetes
Okay.
diabetes mellitus.
Okay, okay.
When the blood glucose also keep on getting to the kidneys and get overwhelmed, it will form some disorganization in the nephrons
Okay.
as well.
Okay.
That will also make that filtration process, it won't be
Yeah.
done perfectly. So diabetes, especially for those that don't have good control of their blood glucose,
Okay.
will come down with the kidney disease. The same also goes with hypertension. Remember, the blood that passes through the system is also supplied to the kidneys. This product that we're talking about, water, fluid, and everything, eventually get down, supplied to the kidneys.
Yes.
And by the time this blood gets to the kidneys, we extract these toxins actually through the blood and then pass on the good ones.
Okay,
and all
okay,
that.
okay.
So when you also have a high blood pressure, the high blood pressure will also keep on mounting pressure when it's going to supply the kidneys. And then with that, it will also damage the function of the nephrons, which will also cause a kidney disease. So with that, you can see how diabetics, high blood pressure, hypertension can actually give you your kidney disease. There are other structural problems that can also cause kidney issues. You know, we hear some women that come down with myoma, uterine myoma, that is fibroid.
Fibroid, okay.
Generally referred as fibroid. It's like a mass, a benign mass that grow in the uterus. And when that happens, from the kidneys you have urethra that go down as they're going down to the bladder.
Okay.
Between the urethra, you have now the uterine fibroid.
Okay.
For all any other tumor that you see inside the abdomen, will place a pressure on the urethra.
Okay.
So when that happens, there is now a blockage. It's just like you have obstructed the normal flow. When
So
there
you
is
have a straight kind of almost
a pipe
kind of.
Yeah.
Then you have something growing in between.
growing in between, or just lying
or
on top,
lying on
lying
it.
on
Okay,
it.
causing
When it lies on it, it's the urine that has been produced can't flow
flow
down.
freely.
And then remember, if just like any urine that you pass will be a culture medium for all microorganisms.
Yeah.
and then if
If
there
it
is now
stays
a
there.
if it stays for a while, there's stasis, and then it will be a culture medium for microorganisms, and then you will have what we call pyelonephritis.
Okay.
It's a common word you hear in the hospital
Okay.
and all that, which is just inflammation of the ureter.
Okay.
And then when this happens, it also gives the same ascending infection I just gave you now, that will affect the
The
kidneys.
kidney. Okay.
So that's also another problem that can also occur. This is just basically the same is how it happens for men that have prostate. When you have a prostate, and the prostate is now obstructing the flow, flow of the urine, there's also this backlog of urine, which will also eventually damage the kidneys, that most people that have prostate, if not treated early, will also come down with kidney.
So what
disease.
causes kidney issues? Because sometimes, I used to think, oh, they've had kidney problem. Okay, they didn't drink enough water. So, but now there's a whole lot that is responsible for this kidney. Now, there are other things that I because we'll talk about the care, but I know you have all this herbal treatment that we get these days. People, some people say it's very good. Even like those trying to control diabetes, say drink maybe bitter leaf and and cook this without measurement. So somebody goes and keeps drinking it. And then there's another one I see on the road now. The ladies, they hawk it. There's some ladies, they hawk it with I think there's alcohol in it, then they give you meat. They say 100% roots, and they cook it together and give you to drink. And I want to get your view on that and the kidney, because the kidney does a lot of cleansing, of course. What does this have any effect on the kidney? Do you think? I don't know.
For us,
what
we call orthodox medicine, we also admit and accept that there is a role of alternate form of medicine.
The herbal one or whatever.
When I mean that there are natural occurring products that can actually help in taking care of the body and all that. I want to give you an example. There's this popular drug most people use now for treating malaria. Artemether-based drug. These are also drugs that are gotten from roots, natural products and all that. So for the orthodox medicine, we have a role where some of these natural components can actually help in taking care of any health issue. But the problem here is that the quantity, the mixture, for it to actually go through the process of scientific process, so that we can actually know the level that is required to take care of any particular ailment you're talking about. Most of the things you mentioned on the side road, abo, mixture, herbal concoction, roots concoction, usually they are mixed in an alcohol-based issue, and then you can actually see that these are things that will overwhelm the kidneys and then get to a point that it will damage it. We are not saying that some of those products, if taken to the lab, can extract some medicinal purposes, but the quantity and the products, all the extra things that go with it, alcohol that you have to take it, and all those are the things that would damage the kidney. And then most of these herbal preparations, you don't also sieve out these toxins you just consume everything. And as we have said earlier on, these are things that will now go down to the kidneys, and if the kidneys get overwhelmed in handling these particular toxins that you feed them on, then they get you now come down with a kidney problem. I will also add quickly that we have discussed everything about the kidney is about both what goes out and also what comes in and all that. And we also talked about that there is blood supply to the kidneys and all that. When there's also a reduction in the supply of blood, for example, for somebody who had bled so much.
So much, yeah.
If you bleed so much, you will your body tries to supply blood to very, very vital organ, especially the brain.
The brain, yeah.
So most other places, other parts
Suffers.
suffers within that time. And if there is no much enough supply to the kidneys, it can also lead to what we call acute kidney injury, which will eventually get to a chronic form if there is any this thing. Then
but does that have to be over a long period of time, or maybe in a sudden, sometimes people can have accident or something. Is that enough to cause such, or has to be over, the short supply of blood?
When we talk about short supply, accidents vary.
Okay.
If an accident involves a major artery,
okay,
that the person is bleeding so much, it means that you have lost so much blood within a short time.
Okay.
And then before that happens, the body will try to compensate for it, and then you hear the doctors talk about shock. This patient is in a state of shock.
Okay.
That shock is that everything, supply of blood is not getting appropriately to where it's meant to be.
Okay.
It's just very close to when we talk about dehydration, not having enough water in the system.
Okay.
Because dehydration will also reduce the blood volume.
Okay.
And when that happens, when there's a reduction in blood volume, the supply to the kidneys will not be adequate.
Okay. Okay.
So it will also make the person get predisposed to having an injury to the kidney.
Okay, so you must drink a lot of water.
Very well.
Drink a lot of water for the kidney. That one is, people say to make your kidney work, you need to take a lot of water to help him increase it. So I'm glad you talked about that in the herbal for concentration, because I remember when I was where I served, we do lots of research, and for us to extract the active component of a particular plant,
yes,
after so much of it, it was just very little.
Yes.
And then I looked at it and said, so all these plants, so somebody could have drank part of it, and it's just little benefit you will get from that plant. So sometimes when people just say, oh, boil it and drink it, it's just little component, and the rest of the components of that this thing will be toxic, to the body. And this is for people who do herbal. Nobody's saying herbal medication, you can't drink one or two, your cucumber, you can drink it, and but just know that sometimes when you have lots of leaf that you boiled or cooked, it's just a little quantity that are that's the active components. I just wanted to bring out that point when I did that research. I actually agrees with what you say. Okay, so now I'm glad you've talked about. I want to talk a little bit about the UTI before we move on. Urinary tract infection. So how do you get that? I know but you make it easy for me to understand.
Just like the name goes, urinary tract infection. So I've tried to describe what the urinary system is, which starts from the kidneys to the urethra, to the bladder, and then to the urethra.
Okay, urethra, where you pass it out.
Where you pass it out and all that. And you mentioned in passing why it's more in female, because they have a shorter urethra.
Okay.
Shorter in the sense that where they void it out is so short that it's easy for infection to come from the outside to the inside. And then secondly, their anatomical structure, how their bodies is structured, is such that they are closed, where from the anus you can actually get infection or any form of that to the urethra and all that. And then also the hygienic way they also carry about their actions will also predispose them to that. It doesn't also mean that men also have urinary tract infection. So both population are exposed to urinary tract infection, and the urinary tract, all through these points, an infection around the urethra, infection in the bladder, infection in the urethra, and the infection that also ascend as far as the kidneys will invariably affect the kidneys. So the main thing about it is just that our hygienic condition should actually improve. And then we'll also, when we talk about the care, part of which is we need to hydrate, take enough water, because when you take enough water, you make more urine, and when you make more urine, you flush out. Even if there is microorganisms, you flush it out. And then we also discourage holding down urine. in the bladder.
Okay, so when you feel pressed,
When you
holding
feel
it
pressed,
and
please find a place and void it, because when you hold it, you are, it's like keeping a jar of urine in a container. And then if you can just do that small experiment, just keep urine in a container and come back the next, after a while, you see that microorganisms will also start growing immediately. So the same way, if you hold down urine in your system, you're predisposing yourself to growth of microorganisms that will
okay, I
eventually.
want to take that again, because sometimes I used to think, you know, is it don't hold the urine, but you know, your mom or your dad, don't hold urine for so long. Go and pass it out. It's not just that your bladder is going to burst.
Yes.
Because some people think, I've never seen a burst bladder. I don't think
Not at all.
the bladder is not going to
It will
burst.
never burst.
But what you're saying is that it builds infection when
It builds infection when you hold the urine, because when you hold it, it's like keeping this end product, because urine is now the end product of all this detoxification that are taking place. Everything that's been taken away from the body is now, so it's like a waste.
Okay.
And you're keeping a waste within your system. And because we also have an exposure that microorganisms can actually get in, so if you they can actually get into that container where you have kept waste products from your body.
Okay.
So they will breathe on it, and then you see growth of microorganisms, and this growth will cause infection, both the bladder, urethra, and then it will eventually ascend to the kidneys and cause a problem.
Okay. What about the popular one that I hear about, kidney stones? Is it, they say drink a lot of water, you won't get kidney stones? I don't know how true that is, but how does that differ? Just I don't know if it's a complex procedure, but just something very simple on how, what causes it? Why would somebody just have kidney stones formed in the kidney? I hope that's what it looks like.
Verified. Just like what we have said, one of the functions, critical functions we talked about of the kidneys is that it takes care of electrolytes and water. Okay. Making sure that there's a balance in that. And then that means if there is excess of electrolytes, the stone that we talk about is just a formation or crystallization
of the iron
of these products, electrolytes we have, calcium, oxalates. When these are things, when they are so much in the system, the body should just flush them out. But when you don't have enough water, that explains why you need to take more water. By the time your end product, when you are meant to discharge this excess components, oxalate, calcium, and all that in a liquid form that will form in the urine, you just void it out, and all that. When there's not enough water, it will just stay crystallized, form just the stones, and those crystals is actually what is the stones that you see, and all that. So, and then sometimes it will form in the kidneys, sometimes it will track down through the urethra, and then they come down the pain. That's actually the excruciating pain that come down whenever when you hear somebody that has a kidney stone and all that. And it also causes an obstructive form. The urethra we are talking about is a very tiny organ, and then imagine a stone blocking the urinary flow. So it's already causing a problem and a pain on the urethra itself that explains the pain that comes with it. And then it's also blocking the urine from flowing out, which will cause a backlog of urine, which will also cause stasis,
of course,
a source of infection, and then it will also go back to the urine. So these are just a whole lot of things that. So, but with enough water,
that can be taken care of.
That will take care of. Make sure that you don't form these crystals that will form these stones.
Okay, well, we're going to go on a quick break. When we return now, I want us to then talk about symptoms and care. Okay. You know, so now we've talked about what causes all the kidney. So we'll talk about the symptoms and then the care for it. We'll be right back, viewers.
Just wanna tell you what I think about you.
Hello, we're starting a new series of episodes on the show Youthful and Purposeful. It promises to be impactful, insightful, enlightening, and refreshing. far beyond the ordinary. We know that you've been looking for an avenue to learn deep, satisfying truths in simple and precise terms that are easy and refreshing to the mind. And that's why we've packaged this show just for you. Join me as we glide through the wisdom that is far beyond this world, one that money cannot buy, yet free, liberating, and exciting. The youth will find purpose, passion, and drive. Even the aged will regain their youth. It's going to be an outpour of doses and doses of electrifying energy. Sure, you're not going to miss it. See you there. And I'll be your host, Sanctified Ako.
Welcome back, viewers. Before we went on the break, we were discussing care for the kidney. Well, that was a topic, but we talked about knew about what the functions of the kidney was, and then now we've talked about also with the causes, what could be responsible for the problem with the kidney. So now we're going to go over to talk on the symptoms, the early symptoms of a kidney infection or a kidney problem. That's the next thing we're going to be talking about. So we want to know now. We've talked about what causes it, which is really interesting. I'm glad for the one of the bursting of the kidney. You know, so if you want to pass urine, the problem is not that your bladder will burst.
Yes.
It's just that you might develop infection or keep back infection in the bladder. So symptoms, the early symptoms, the earliest that somebody can notice that, hey, there's a problem here, a problem brewing here, you know, for the kidney.
Okay. You know, for us in medicine, some of the symptoms that we see just derive from the functions. So when we look at the functions that we have talked about earlier, and then we now see a malformation of those functions, then it will present that way. One of the earliest you can actually see, you see people having bag eyes, saggy eyes, have swellings, facial swellings. Swellings in the eye.
Under here,
yes,
the bag of the swelling.
Yes, and all the sudden swelling in the legs. In fact, usually that's the most common one that you will see. The legs are swollen, and this we can directly link to when the kidneys can't handle water and the electrolytes enough very well.
All right, so you have them retained.
They are now retained because the oncotic pressure, the pressure that takes back this water, will not allow it to be reabsorbed. So what really happens is that water goes to dependent areas. Dependent areas, like you have tissues around these areas that they can easily have water accumulating in them, both in our feet, especially in the feet. Some, when it's now getting so bad, you'll see also a swelling in the stomach and all that. That's one of the first and earliest sign that will tell you that there is something going on in the kidney. One other function or one other symptom that you see, that you just see suddenly somebody will start going pale, not having enough blood in the body. When you check in the lab, they will not be as pink or reddish as we can see in the palms, in the leaves, and all that. Then you also see dehydration, dryness. They get thirsty a lot. Their mouths are dry, and even their skin will get dry. So that's also a sign to show you that this person is really dehydrated. And that because this person is dehydrated, you will also suspect that the kidneys are not functioning very well. Then we also have things like coming down with different types of infection. Remember we talked about the vitamin D being produced in the kidneys, and because if the immune function that vitamin D brings to the system, if they are not there, you can actually see that the person will come down with other forms of recurrent infection. And then we'll also see things like the urinary tract infection, frequency. What happens is that the person will either want to go and pee at a very short time, or they will urinate more frequently than normal.
Okay.
And all that. You can also see by the time when they get to the toilet, before they get to help themselves, they're already peeing. So these are what we call urgency and all that. So some, especially the ones that come down with infective process, infections will come down with fever as well. High temperature will be detected. So these are things that can actually occur as the signs of
physical signs that you can monitor
physical
by
signs that
yourself.
you can by yourself.
Okay, so swelling on the
legs and all that. And the very common things that you can actually do when the person comes to the hospital, which can also be done at homes and all that. That's the first sign you will see that there's something going on in the kidneys. Is that when you do a simple test we call urine analysis.
Okay, urine
there will
analysis,
be protein in the urine.
Okay.
So normally the body tends to absorb most of the proteins.
Okay.
The nephrons are so tight that it will not allow them. But when you start seeing protein in the urine, you now know that the kidneys are not functioning optimally.
Okay.
For those that are now more complicated, or those that have actually been in a state of failure, the kidneys have failed for a longer time and they come down with more complications, will notice things like hiccup and all that. By the time you check their kidney function tests, you actually see that they are actually very bad, because when the urea is very high, it actually irritates the diaphragm that causes that hiccup to come on.
I like that. Swelling in the leg. Okay. All right. Paleness, dryness of mouth. I was just looking at symptoms, but it's not out of place to just go and do urinalysis in the hospital. You know, just before, there's some questions going on my mind. But what about color of urine? Does it say much to, there's something that was trending one time, and you see different colors of urine, and they say, okay, at this stage, you should start watching it. If the color of your urine, if you see blood in your urine, if you notice that your urine is foamy, I don't know, does the color of the urine say anything about the state of the kidney?
Yes, that's actually, when I talk about urinalysis, it's an analysis of the urine. Okay. And these are the results that you come down with. It's almost like a 13 panel things that you see in a urinalysis, and the color is one of them. Obviously when there's blood in the urine, it means that there's something going on in the urinary tract. It can actually come right from the bladder to the urethra to the urethra and the kidneys. So all through that, it could either be an obstructive cause, either from your kidney stone or from what we call polycystic kidneys, and that is now bleeding. So all those can actually happen all through that. So when there is blood in the urine, it's a marker that we'll have to look further to know what is causing that. You talked about frothiness. It's also part of, in fact, that's when you see when there's a lot of protein in the urine, it will actually foam a lot. So that's one of the things that we can actually see from just the appearance and all that. And it will also, we also see glucose more in the urine. And then in that same panel, I talked about 13 things we look out for. There's a particular one we call nitrate. In fact, whenever you see nitrate, you're almost sure that there's a urinary tract infection going on. And for those that are diabetic, you can pick up your ketones and all that. So that's the first marker that you will see, and then this is the first test that we'll want to do. But beyond this, you now want to confirm what is going on in the kidney to actually know the kidney function and all that. We'll do a test we call serum electrolyte urea creatinine, just like we mentioned. The electrolytes which the kidney should actually handle very well will not be handled very well. So because of that, you either have a low levels of some of the electrolytes, sodium, chloride, potassium, or you also have a very elevated levels of them. Then you can also have urea, and then the creatinine level being high. Usually when this is high, we use it to calculate what we call a glomerular filtration rate.
Okay.
And with that, we can actually stage or group the kidney function to different level. Generally, for those that are above 60, we can say that they have a good renal function. But when we start having anything less than 60, an ideal, you're above 90, but 60 to 90 could still be a good
deal, but you need to watch it at that point.
But anytime you start having kidney function, glomerular filtration rate that is less than 50, we can now classify the different classes of kidney
infection. So the important thing now is the basic symptoms we have talked about. When you start noticing things like that, it's good to go and see a doctor, and let them check, what is going on, with your body. And that's why we have programs like this, is to get that if you're noticing swelling, paleness, swelling in all these places, airbags that you didn't need to have before, then dryness of the mouth, looking for water all the time. And then maybe sometimes I know when you have painful urine, or just anything abnormal with that area, yes, then it's important for you to, see a doctor quickly, because I think this thing sometimes they just start going in minutes and days, and before you know what, you're at a very bad state. So now care for the kidneys, where we want to go to now. That was what we were supposed to be talking about since, but I've learned a whole lot on the functions of the kidney. But now, how do we care for the kidney? Because I know if you treat the kidney right, it will treat you right. Very well. But so what do we do? Do we keep drinking all those teas that say you have to be alkaline in your body for you to but how do we care for the kidney? What are the things we do, the basic things? I know water.
Very, very important. The truth is that from the little discourse that we've had, we could see how important the kidney is to the system. And as such, the key word in the care of the kidney is prevention. As much as possible, we have to look out for the risk factors, look out for things that will predispose us to kidney issues, and then we'll take them and make sure that we'll prevent any form of kidney infection. Because of our healthcare system, care for the secondary or tertiary care for the kidneys are very, very money consuming. When we start talking about dialysis, kidney transplants, and other forms of things. So the best thing is to prevent kidney problems. And then how do we do that? Just like we have said earlier on, that we have to always be hydrated. Take enough water. Make sure that you have enough water to sustain your system, so that your blood volume will actually be enough and adequate to supply the required blood that your kidneys need at every time. Because dehydration, we have seen, is a major cause of kidney problems. Then the other risk factors, like the poor lifestyle, substances abuse, alcohol, cigarette smoking, use of herbal medications, even orthodox drugs like analgesics, opioids. The drugs, normal
painkillers that you call painkillers, you take carefully.
The word is the use of painkillers and all that we try to use, and people just for the mere fact that they just they have body pains, they just come back, they always feel like give me painkiller and all that. Non-steroidal anti-inflammatory disease drugs have been found to be major cause of kidney failures.
Wow.
And then it's a major cause of kidney failure. And most other drugs, that's why as much as possible, see your physician before you take any drug. So even the regular medications that if it's not prescribed by your doctor, you shouldn't just be on any kind of drugs and all that. Then like I also said, there are drugs that people abuse: opioids, tramadol, cocaine, cigarettes, alcohol. These are things that will form a lot of bulk to the kidneys, that the kidneys cannot really handle them, and then they will cause a kidney failure. We also talk about herbal medications, just like we can actually see that most things, most herbal concoctions that we get to see may just have very tiny ingredients that may be medicinal, but the whole bulk of other things are junks that your body will not need. And then when you feed, or when you put on these pressures to your kidneys, it will overwork it, and when it's overworked, it will fail. So we encourage and tell everybody not to take herbal medication, not to take substances, not to take abuse drugs of any type. For those that are diabetic, please have a good control of your blood glucose. Make sure that you have a good range, because when we get to a point where what we call diabetic nephropathy, affectation, diabetes affecting the kidneys, then it will bring down, it will come down with chronic kidney disease. Then also control your high blood pressure. Make sure that the blood pressure, if you're on using lifestyle to control it, you control it adequately. Then if you are on pills, take your antihypertensive, so that they will not, the pressure will not mount on the kidneys. When that happens, you also come down with kidney failures. So have a good control of your blood pressure. And then we also encourage, if you have any form of infection like the urinary tract infection, treat early. Try to see your doctor, and also try to make sure that your if it's use of antibiotics within that period to clear off the infection. Like I said in the introduction, there are also a class of people who, without their making, they have a genetic predisposition to a particular type of kidney issue. You should also see your doctor early, and so that they can actually keep placing an eye on it and adjusting your medication. There are also another group, congenital in the sense that they were already formed, they were malformed right from birth. So these are also a group of people that need a closer attention to make sure that their kidneys does not fail. Some may just have one kidneys. You just know that you have to take care of your kidneys while you progress. There's what we even horseshoe kidneys that can actually connect together. These are abnormalities that could occur, but it's just for you to know on time and then follow up on such care. This, I could classify this to the primary, and then a little bit of the secondary care, where you have to treat problems for the secondary care. Then for the next other way, how we also take care of the kidneys, is that when we have any of this, assuming we have not prevented these issues from coming, and we got to a point that we have hypertension, we have diabetes and all that, you still have to protect your kidney so that you don't come down with chronic kidney disease and all that. But assuming you are at that point, at this time, then you will now ask me, okay, how do I progress from here? So we have to we have to monitor your kidney function regularly. You have to be seeing your doctor to keep on doing a serum electrolyte, urea creatinine, and monitor your, especially your urea and your creatinine level. And then potassium. These are these are markers that we want to be sure that they are within a normal range. Because it gets to a point when, if they are too much in the system, they start affecting other organs, to the point of, if you have so much of urine in the system, we can even have what we call uremic encephalopathy that will cause coma, and then most times people die from it, all that. Then when we have gotten to that point where the kidneys has failed, we have gotten to end stage renal failure, we have different stages from stage 1 to stage 5. When we have gotten to a end stage renal failure, or at a point where the kidney functions the kidney cannot cope on itself, and all that. There are other things that can be done with, like the use of dialysis. Dialysis is now bringing in a machine that will help take away and do the function of the kidneys. But because we are in a resource poor environment, an average section of dialysis ranges from 35 to 50,000 naira per section, and sometimes the same function that your body is just taking on unconsciously. Now you need to do that every day. Some other person 3 times in a week, and then you could actually understand the kind of financial burden that will place on the family if you need to do at least, maybe take for instance, you need to do 3 times in a week.
As you're spending over 100 and something thousand
without other care
that
taking
will come
up,
in the hospital.
that will also come in and all that. So it's actually very expensive. And then there are also some levels where we can continue with the dialysis, because it also has its complications. You are using machine in your system. You can also get infection through that, viral infection, HIV, hepatitis, through that procedure and all that. And even sometimes one can actually get infection on the site where you are also doing the dialysis and all that. And people would advise maybe going for transplant, which is also another
world on its own. That's another complex.
Because you also have to get somebody who is the donor, who is also compatible, and then you also have to be on immunosuppression so that the kidneys can actually take and a whole lot and all that. So these are things that we have to do so that we don't get to this point.
Yeah, so it's important to care for the kidney, so we don't get to the point where we need to spend over 150,000 in some hospitals in a week or in 2 weeks for just going to pass urine. You know, that becomes very, very difficult. Okay, before we go, because we are winding up now, I want to ask some questions that I have here. You know, well, I think we've kind of answered this one, but let me just ask it for the benefit of those that are asking it or are thinking it. It's out there that it looks like there's some kind of alcohol that cleanses the kidney.
The truth is this, that there's no form of alcohol, any form that cleanses the kidney. In fact, alcohol damages the kidneys. Because just like we have just tried to say, these are products that contain toxins. It will eventually get down to the kidney, and when it gets down to the kidney, when it gets overwhelmed by the quantity of this alcohol that it needs to handle, then it can also cause a failure. All that. So
no form of alcohol.
No form of alcohol.
It's going to clean the kidney.
God does any cleansing. However, the erroneous thinking is that when you take a lot of alcohol, you need to pass a lot of urine, because it's fluid and it's going through the kidney. The kidney is overworked and is trying to process and also eliminate them, and you are pushing more into it. So it's like putting so much pressure on the kidney. In the layman's thinking, you think, because I'm passing urine, I'm actually cleansing
my body.
The body. But what is actually happening is that you are giving more work on the kidneys. And when you have these pressures, when you give this so much work to the kidneys, it can say, okay, please leave me alone. I'm packing up.
Okay, and then does taking cold stuff damage the kidney?
Cold stuff?
Cold drinks, or, you know, I know why you're laughing, but I need to ask the question. So if you take cold drink, does it damage the kidney?
The truth is this, that cold drinks, you know, the body has its own temperature. From the time, no matter how cold it is, by the time it enters your mouth and goes through your esophagus, it takes the normal temperature of the body and all that. So that temperature, there is not that exchange that takes place. The hot part of your body will give back, and then the normal temperature will balance that the body requires it, and it goes. So before it gets to the kidney, there's no business with the cold, because this will go through the stomach before it's passed to the bloodstream. It's actually from the bloodstream.
That's a very interesting thing, because
before it gets to the kidney.
Apart from the kidney, people think that if you take cold water, it congeals the intestine and it makes it very difficult. Yeah. I think that is what is out there. The way you argue it, and I'm confused. I'm like, I can't. Maybe I don't understand what I learned in school, but by the basics, it shouldn't do that.
But it is how you understand the levels that it will pass
through to get there.
From the mouth to the esophagus to the stomach before.
Then to the it's all okay. So and then you know, there are capsules and there are teas that they sell that say they're for cleansing the kidney. Do we need to take them? It's everywhere. There's so much tea. So much. This cleans the kidney, it balances the kidney, it washes the toxins from the kidney, and I'm wondering how does it work? But any truth in that?
The truth is that all this are not required for the body. These are things that will damage our system. We try to, with every opportunity that we have, to tell people that most of these teas, as a person, I call them either Chinese herbal medication. They formulate it and give them good packaging and bring down to us. It's just like your normal abo. Somebody is selling
but he repackaged his own.
They've just repackaged it and sent it down to you. So these are things that in the long run will have an effect on the kidneys. Any form of tea, any form of that are just herbal drugs or herbal leaves that they just give to you
package from somewhere in another country,
and it passes through the same process of overworking
the kidneys. So we don't need that. We don't need to put burden, any more burden on the kidney. Then finally, what kind of foods do the kidney like? I'm asking you the question. I see if you're the best friend to the kidney.
It's very fine. The truth is that for the healthy living that we advocate at all times.
Fruits, vegetables. Water, a lot of
water, less of chemicals, less of sugary things, less of carbonated drinks, less of things that have colors, things that are produced in the lab.
That's to have 100% concentrated.
Synthetic, any form of synthetic food, the kidneys will not want.
So keep it natural for the kidney.
Please keep it natural.
Keep it natural as possible for the kidney, and the kidney will be happy that you're doing it. And hydrate the kidney enough.
The truth is that we recommend as much as 3 to 5 liters of water every day.
3 to 5 liters of water. Have I drank up to 3 liters of water today?
Day. Any day you've not made up to 3 to 5 liters of water, we have not done so well. And also in some climates where we also have a very hot weather, just like ours, today and all that, we need to take more
water
because we are perspirating more, we are sweating more on such days. So your daily water need for such days should be more, and we have to take more.
Thank you so much for coming on the program, Dr. Chimbi. It's always an honor to have you. I've learned so much today, and I believe our viewers watching have learned a whole lot about the kidney, especially how to care for the kidney. Dehydration is one to watch on. Take a lot of water. Take a lot of water. Thank you, viewers. For the past minutes, we've been talking about care for the kidney, and I believe you learned a lot today. My guest has been Dr. Chibuike Chimdi. He's a specialist family physician at the Metama District Hospital here in Abuja. Thank you for joining us on the program today. I'll see you next week. I am Angela Weze. Goodbye.